My name is Rachel Jordan. I'm an athletic trainer at the University of Florida, and I'll be doing a video on vestibular ocular motor screening, or VOMS. When assessing a patient using VOMS for concussion, first assess baseline symptoms. Record their headache, dizziness, nausea, and overall fogginess on a 0 to 10-point scale. Then you can begin the exam. You'll need a metronome, tape measure, and something small to focus on. In my case, I used the tip of a pen. For smooth pursuits, the patient will be following a smoothly moving target. The examiner and patient are seated. The examiner instructs the patient to focus on the fingertip about 3 feet away from their face. The fingertip is moved slowly and smoothly about 1.5 feet above and below the midline, all while the patient keeps their head facing forward. After 2 repetitions, the examiner will move their fingertip to the left and right 1.5 feet in each direction past the midline. Again, this is repeated 2 times, and it should take about 2 seconds to go from one far point to the other. Afterwards, assess and record their symptoms. For cicades, the eyes are tested by quickly moving between 2 targets. Both the examiner and the patient are seated again. For horizontal, the patient should be instructed to keep their head focused forward while the examiner puts a target on either side of the midline about 1.5 feet away. They should then be instructed to move their eyes back and forth between the 2 points as fast as they can for 10 times. Assess and record their symptoms after this test. For the vertical cicades, once again place the target 3 feet away from the patient's midline and place 2 targets or fingertips above and below the midline at about 1.5 feet in each direction. After 10 repetitions as fast as they can, assess and record the symptoms. Next, convergence measures the ability to view a near target without double vision. This is where you'll use the tape measure and a small target. Both the examiner and the patient should be seated, and the patient should use any corrective lenses if applicable. The patient should be instructed to hold the target at arm's length and slowly bring it toward them. The examiner instructs the patient to move the object toward their nose until they see 2 distinct images or when the examiner sees an outward deviation of one eye. The examiner should record with a tape measure the distance from the nose to the target. This should be repeated and recorded 3 times. Measurements over 6 centimeters are considered abnormal. As usual, assess and record all symptoms afterwards. For the vestibular ocular reflex test, both the examiner and the patient are seated, and it assesses the ability to stabilize vision as the head moves. You will need a metronome for this test. For the horizontal test, the examiner will hold a target 3 feet away from the patient. They will instruct the patient to keep their eyes on the tip of the target while they move their head left to right on either direction in about 20 degrees. They will use a metronome to stay at a steady pace of 180 beats per minute. 10 repetitions should be performed, and then assess and record the symptoms. For the vertical test, the examiner will once again tell the patient to focus their eyes on the tip of the target. This time, they will move their head up and down, going at about 20 degrees above and below the midline, and once again using the 180 beats per minute. After 10 repetitions, once again assess and record the symptoms. This test tests visual motion sensitivity and the ability to inhibit vestibular-induced eye movements using the vision. Both the examiner and the patient will be standing up, with the examiner slightly to the side and behind the patient. The examiner should instruct the patient to stand with feet shoulder-width apart. They should be facing a busy part of the clinic. The patient should be instructed to keep their thumb out at arm's length and focus on their thumb. They will rotate left and right approximately 80 degrees and will go at a metronome pace of 50 beats per minute to either side, with 1 beat in each direction. Do 5 repetitions and then record and assess the symptoms once again. Abnormal findings from the baseline should indicate a referral.